What's going on, guys? Today I'm going to cover a little bit of the session I had with Sergio Oliva Jr. last week when I went out to Vegas to help him out with some of his shoulder issues. There's a little bit of a minor shoulder issue, nothing big. There's no structural damage. MRIs are clean, so I was positive I would be able to help him. So I reached out and we set it up. So what I want to do is just cover my assessment process. You'll be able to see my thought process. I'll show you what I was looking at. We'll go over a couple of the treatment protocols and kind of how I see this working out for Sergio. I don't see any issues at all. Why he won't be able to be on stage this year at the Prague Pro if that's what he wants. He said that's something he might shoot for. So when Sergio was describing to me his limitations, he said he didn't have the ability to get into a front double bicep. So that is external rotation. And then he also said that he couldn't really do like vertical motions, couldn't do pull downs and things like that, like straight up pull downs. No real pain, just limitation. And that's the thing with a lot of bodybuilders, we're so connected to our body that we're able to kind of push tension around so that we don't really aggravate something too bad. We kind of work around it, but we can't work that way forever. We're going to really limit our options. Then we're going to compound until we get to the point where we actually do have a limitation we can't work around. So I really knew kind of exactly what was going on in my head because bodybuilders, and especially powerlifters even more because they have to work out with a specific range of motion. They do even heavier weight. But bodybuilders tend to not be so complicated to help with their issues because there's not a ton of strategies that they can resort to because they're producing so much force. The average person that I help who just is a person who might work out recreationally 3 times a week, they don't have to produce nearly the levels of force. They have a lot of different movement options, a lot of different ways that their body can move through this world because they don't have to produce that amount of force. So they have a lot more compensation options, so a little trickier than a bodybuilder. So I knew Sergio was going to be dealing with a lot of just general extension. I figured his upper left back, that dorsal rostral area, would be very compressed. Now, I actually made a video about how to build 3D delts. I'll link that up here. And I kind of made that in preparation to seeing Sergio. I was kind of lining my thoughts up on what I was going to do because I knew that's what his limitation was going to be. Let's start with the assessment. Sorry, I kind of, I wasn't real formal about this. I wasn't trying to like set up videos everywhere. I just wanted to make sure I was really present in the moment. So there's a little bit of background noise. I put some captions on. I don't think it's too bad, but sorry about that. So this is how I always start my assessment. I get my person flat on their back, and I'll walk you through what I'm doing.
Pelvis is a little dump. That's normal. You gotta produce. Yeah.
So I'm saying he's pretty flared. His pelvis is pretty dumped forward. So I'll use this pelvis model to help a little bit. So what I mean by that, when I say he's pretty flared, is because he's on the table. His femurs are already really externally rotated out. That's because the pelvis is in a position that makes those femurs orient that way in the hip socket. To fit in that acetabular rim, it has to kind of orient a little differently by going into that external rotation. So when I say dumped forward, I mean an orientation of the pelvis anteriorly, which just means like that. So he has pelvis dumped forward, that causes that external rotated femur position. And I mentioned it's not that uncommon because you have to produce force. Again, that's something you're going to see if you're working out heavy and hard, and I know Sergio is, and I know he was, especially with Dorian, which we'll cover a little bit later. You're going to produce some extension just to get a little more force. It's pretty hard to avoid, but you need to be aware of it.
Yeah, I mean, like if I'm nitpicking, I sometimes get clicky in here. Yeah. It'll click a couple times. If I do stiff leggings and my legs are too close together, it pops.
Do you have any?
So he's saying that his left hip will get clicky sometimes if he does stiff legs that are a little too narrow. So I haven't even like looked at any of his ranges of motion, just looked at him flat on the table, and based off of what I see and what he told me, I already know he's gonna have very little left hip internal rotation. That's the reason why he wants to kind of go wider with the legs because, like I talked about, when this pelvis is dumped forward, it changes the way that acetabular rim kind of sits with that femoral head. So in order to get space to internally rotate into, you got to go out wider to kind of match that new position of the joint. And so if he doesn't go wide enough, he's going to get that clicking and popping on the left side. And so after this, I ask him if he has any kind of shift or anything, because you usually will see that, and he's not aware.
Any shift at all? Anybody like to shift anything?
No.
Like when you're doing a deadlift, if it kind of turns to the side, or a squat if it turns to the side.
So let's see what's going on. Go through some passive inflection. So let's say you're about easy 5. It's actually not terrible. That's terrible. That's really.
So no internal rotation at all. So I checked his hip flexion passively. It was decent, about 85 degrees. Okay, external rotation, but like zero, absolutely no internal rotation. I was a little surprised that there was none.
So that tells me that you're just very dumb forward. If you got a good ER but no internal rotation, pelvis is like
when you did
really
that,
forward.
I felt it in there.
And when he's saying he felt it in there whenever I internally rotated his femur, he means he felt it because that's like an osseous blockage. That was just the bone hitting the bone. So it's a different feeling. It's like a hard stop. And what I'm talking about is he's so dumb forward, especially on that left side. So we have that normal anterior orientation, and with that you're going to get some flaring of the pelvis. Now what I'm seeing is that, and on top of this, he's really turned this way. And so when you do that, that makes this one left flare even more, and this one starts to turn in, that left comes forward a little bit. So he's really just closed off all that space internally because he's so tipped forward because his left side's so far forward. As I mentioned in the video, when you first tip a little bit over, you actually open up some internal rotation space. But as you continue to go over, your lower posterior muscles, like your glutes and things like that, they start to really tighten up to keep you from just toppling over. And so that actually starts to close out your IR.
When you go forward just a little bit, you actually open up IR space. Then as you continue to go forward, these lower muscles, they kind of tighten up to keep your
That's what I'm talking about here.
falling over. And they close that IR. So the right side's probably gonna have a little more. Let's see what's going on. Oh, I should do a straight leg too. All right, yeah, you just played dead, no help.
So that's a decent straight leg raise, but it's fake.
But it could be just because your pelvis is so dumb forward. It's kind of
Because his pelvis is so dumped forward, we have that anterior orientation. So if I'm on a table and I'm anteriorly oriented, as I lift up that femur, I have room to tilt back and still go flat on the table. If I'm already starting flat, I'm gonna hit that in range sooner. So we're seeing a little bit of fake straight leg hip flexion because his pelvis is just kind of oriented forward, so it's not real. It's just moving in space more.
give me a fake one, probably.
Well, like flexibility, I'm okay. But
And Sergio can do splits and things like that. Like, you can be really limited in internal rotation, but because of orientation strategies, you can feel mobile and not be limited in most ways.
yeah, there's just certain things.
But there's just certain things. But there will be little things, like you have to move your feet wider on a stiff leg deadlift.
Right away, this kind of deviates, pretty, doesn't stay on center, so it's definitely flared out.
Yeah.
And so, as I mentioned earlier, we got a few things now, right? So we start with a anterior orientation, then we start to turn to the right. That makes this left one turn forward and out, left one kind of comes back and then internally rotates. And so as I try to check his hip flexion on the right side, his pelvis is so turned that way that it just won't line up at all. This is so turned out that way that it just isn't any kind of like a straight line. It has to deviate out of right away. So none of that is real, actually.
But see, look at that IR difference. I told you, that's way different.
Yeah, and I don't feel.
That's like excessive IR. So right now, Sergio's presenting a lot of asymmetrical stuff. He's got bilateral compensations on top of it, but when you see one IR that's nothing and one that's like 35, 40 degrees, you're really, really, really rotated.
Either.
So you're two things. So everyone's kind of underlying, kind of on this right side. We're turned a little bit to there. So you're pretty turned into here and pretty forward on the left. And then on top of that, you have this.
So that's just a normal left AIC pattern and a BC pattern, a right BC pattern that's a little bit tumped forward.
Called a pec layer, like a posterior extension chain, really tight. So you're.
And so to produce force, you can't really produce force when you're so asymmetrical. So he's had to kind of get this extension chain pattern to open him up a little bit so he can do these bilateral moves with heavy load.
Here, and then you've kind of pushed through there to here. So we kind of got to get your paraspinals and stuff to chill a little bit first. Basically, it's activating your deep core shit. Breathing. It's so simple. And then after that, we can start getting you out of this right side and make your way into your left.
Yeah, so sometimes I'll actually see someone get a little more asymmetrical after getting rid of that bilateral patterning.
To fix your shoulder, you're going to have to get internal rotation on that left hip.
Sure.
Yeah.
So the reason I'm saying we're not going to be able to get the left shoulder to do what we want if we don't have left hip internal rotation is because if we don't have the ability to truly turn into that left side, meaning the ability to get in to internal rotation, what we're going to do is up top on the T-spine, which I had a full skeleton, we're going to turn that way. And we're going to rotate through that extension position in the T-spine. Every single step you take when you walk and when you are doing things like lunges, unilateral moves, pretty much anything that involves any kind of reciprocal motion, you're going to reinforce that compression strategy in that upper back area. So between not being able to properly turn into that left side because you don't have real internal rotation, you're going to use that compression strategy, you're also going to use that compression strategy to go into extension to try to gain that IR that you don't have. So it's kind of like a cycle. So we have got to get left hip internal rotation in order to get posterior expansion of that upper left dorsal rostral area. And again, I cover this in the video about how to build 3D delts. If this is confusing to you, check that out. I cover this like in pretty good detail. And so once you get that left hip internal rotation, you can move into that side properly. Now we can really work on getting that upper left dorsal rostral expansion, getting that part of the rib cage to expand and be more of a convex shape so that the scapula, which is concave, can slide over it and glide over it a little bit more effectively. And that's going to give us a lot better scapulohumeral rhythm and take away any kind of limitations that we may have.
Wow, yeah, because like I said, it all has that polyarticular muscle chain together. So let's look at these arms.
And I mentioned a polyarticular muscle chain. This is something that PRI talks a lot about. That's just a series of muscles that work together and overlap at multiple joints. Whenever you look at cadavers, these muscles are almost indistinguishable. They're so intertwined with the connective tissue and with each other. So when one thing's off, it's going to throw the whole chain off. So that's why we've got to work on keeping our ribs stacked and our pelvis in a pretty good position, and that'll take care of pretty much all of that. So now we're looking at the upper body. No restrictions there whatsoever.
I'm assuming your IR is going to be a little limited on this side. Oh, that's not bad.
I thought his internal rotation would be a little limited on the right. Not at all. And that tells me that he's just so far turned that way that he's got like fake IR.
That's we can work with that. Okay. Yeah, but that'll be worse than this is. So let me see what's true ER. So something hurts. Let me know. We'll have to do like a tiny little bit of manual.
Yeah. That's okay. I'll tell you if it's.
I did have to do a little bit of manual therapy on him as well. Nothing crazy, just, maybe 10 minutes worth.
It's not really bad.
All right, so.
And you can see that's not wanting to go at all. When I'm trying to check his flexion from that position, we're hitting that compression technique right away. We're going into extension. That scapula will not glide at all. It's just jumping up and in. So that's what we got to work on. We got to get that upper left dorsal rostral area to expand so the shoulder can move good. But we've got to get left hip internal rotation to facilitate that.
First thing we got to do is inhibit that pec. But I'm going to do a couple of slight, just one hair over there. Okay, let this arm hang. Okay. All right, let's try that on the other side. See if that side drops a little bit.
So right here, actually, I'm checking to see if there is a big difference as far as the room in the joint for his humeral head to move. I'm just doing like a drop test on the side to see if his arm falls and goes down a little bit, and if it stops, if it's kind of just springy, or if it doesn't go very much and it's like a hard stop, which would indicate an osseous blockage, like you're hitting the bone.
So your pec's a little tight, and you see how this kind of like goes and is springy, pretty deep. Let's come over here one more time. That stops, and it's kind of like a harder stop. This is the sternum. You're getting a little more of like an osseous blockage. So if the right side hangs off, left doesn't go so good. It's a little bit of the sternum, but yours isn't so bad because again, you got that pec on top of it.
So I would think his left would be even worse, but since he has to produce so much force, he kind of has reoriented the sternum just a little bit.
That actually might get even more asymmetrical for a second until we fix that. Let's face that way. I'm gonna be on the side. We'll do this bent to like 90 degrees.
Okay.
All right, so this is hard. You gotta go just totally passive, just chill.
Okay. All right.
So this is the classic Ober's test, or the adduction drop test that they call it in PRI. And this is just gonna let me see kind of where his pelvis is. I mean, I really knew what I was gonna see as soon as I saw him just lay on the table, but I wanted to feel it to see what the differences were.
You're gonna be the second biggest dude I've ever done this to. So, okay, so I can tell your capsule's locked in, so that's why you don't have any ER. The femur's sitting in the front of this. And again, that's all your bone, like your limbs, it all is dictated by your pelvis and your rib cage. So once we get those.
One thing that Sergio mentioned to me, because I asked him after I saw this, there were some things that I was like, we got to be reinforcing this kind of negative pattern somehow. And he said that he sleeps on his right side with his left hip, left knee really turned over. So if you're sleeping on your side and then you're turning that, reinforcing that turn when we're already turned that way, you can see why that could be, magnifying some issues. So some people say how you sleep makes no difference. It definitely can if you're having issues. It doesn't always. I used to never be able to sleep on my stomach when I had some of these issues. I was like so uncomfortable. If I ever did, I woke up with so much pain. Now I can sleep anywhere. I can put my arms anywhere. I can sleep on my stomach, back. I'm all good now.
So everything will start fixing itself, and it's almost so simple. It's frustrating because I used to do.
I know. I was just thinking, how's it going? Never looked at me and said.
People don't know this shit like in the bodybuilding world. That's what I'm trying to bring. Like, no one sees the leg, but I see the leg obviously for.
Here, Sergio expresses something to me that I heard a lot. Was like, how come no one's ever told me this stuff? And the truth is, there's a lot of really good therapists out there that do this stuff, but most of them don't. And I don't really know why, but you know, where I'm at, I'm inundated by people that are in this field and know these protocols, these methods. But if you're not, this is totally foreign to you. And it's so simple and logical once you understand the concepts behind it and the system in place that it is frustrating. I'm telling them it's frustrating because when I used to have issues, I would have to mitigate them and it would take weeks. Sometimes I would have to do all this stretching. When in reality, all I really need to do was to get my rib cage and my pelvis to sit on top of each other and to be able to take good breaths. And that's kind of all you really need. You know, when you do that, when your exoskeleton is aligned, you've got maximum joint space. You've got maximum operating room for your limb. And this isn't stuff that like I've made up at all. There are people out there way better than me at this, but they're just not really in the bodybuilding world.
Injury recovery, but also for developing like aesthetically. Like if you have this pec pattern really bad, it's harder to get like really good lats. Can also make your stomach more descended because your pelvis is descended. That's how your stomach is sticking out.
And so if you're watching my videos, you've heard me talk about how you lift affecting your aesthetics. And so again, if you get too far in this extension pattern, you get flared ribs, you get dumped forward pelvis, your pelvis becomes descended, you get the belly pooch, it becomes harder to make yourself look like you've got a small waist, it gets harder to develop your lats, your lateral delts, your rear delts, all kinds of issues if you fall into this.
So just totally chill. Oh, fucking heavy leg. It's like a 45-pound leg.
So if you can kind of see, I'm trying to get this hip into extension. It's not going anywhere near there. I know it's not going to happen because, again, he's forward and he's turned.
Okay, straight to the side. So I can't even get you in the test position on that, so that's a fail. I'm assuming I probably can't get you in here either.
Okay.
But the first goal would be to get this right side to clear.
And I say the first goal is, again, we have to remove this outer layer of compensation that has got us into this pec pattern. So when you're so dumped forward, neither side will clear, but eventually as we get more pulled back, we'll still have to do a little bit of rotation, but at that point we'll see that the right side's clearing and then we'll know that our pelvis is at least relatively neutral, especially in that frontal plane that we want. If you follow Bill Hartman at all, which I doubt any of you guys know, you'll know why I put the frontal plane in quotes.
That is a lot easier to get close to there, but it's going to hang too. Okay, cool.
And on that test, if it is a hard hang, it's an osseous blockage. If it's a soft hang, it's soft tissue, so you're a little closer to where you need to be.
No, that'd be cool too, and what I'll do is I'll start like posting it.
Yeah, that'll be awesome.
And then we can try and get this.
Yeah, dude, you're gonna be, it's gonna be easy.
Okay, yeah.
Let's go to your back.
Okay.
Go ahead and do the more aggressive ones. It's just fucking big. You don't need a weight necessarily. Just put your feet flat. And bring them in a little more.
Right in? Yeah.
Okay, let's grab a hold of this. Let that arm just hang.
So the first thing we're going to do is this pec inhibition on the left side. It's a really common thing that we do in PRI since it's presenting so asymmetrically and has got a lot of issues over here. The more superficial muscles are a little bit aggravated since that sternum's so turned. This is really pulled tight. So we're just doing an easy inhibition, and when someone's like Sergio, like just a really, really strong person that produces a lot of force, a bodybuilder or a power lifter, we need to inhibit certain things before we can really make any changes. And those are typically going to be your paraspinals, meaning like your back, because it's so used to being super extended to help support you. A lot of times we need to inhibit this pec major like we're doing. A lot of times you need to inhibit the right intercostals or lat. And these are all things that we did. I didn't film all these. I think I only filmed the pec inhibition, but you kind of have to inhibit before you get anything done with these kind of people that are just so good at producing force. So we're going to do a left pectoral inhibition.
You get pain, just let it rest. You're going to try to turn the thumb that way. And this is a hard ass. Can you like give me a little bit of activation?
It's supposed to be ask, not hard ass.
Scap like go all the way back and kind of like. Like that. Yeah, and then let it hang through there so we're on the peg and not just going through that extension.
So what I just asked him is really difficult for someone who's super compressed, but I love working with bodybuilders because they're so connected to their muscles. They're able to do things that normal people aren't. So I have him just trying to do nothing but breathe and keep a good rib position and let this stretch, let this inhibit it on his own. But he's so compressed that as he goes out there, his first move is to immediately let that scap jump in and go into extension there. So what I'm asking him is to Just breathe and let this rib drop a little bit. That's going to give a little bit of posterior expansion. That scapula, you'll feel go a little bit outside the body. And now we'll feel more tension here. We can't like turn on the pec that we need to inhibit. So it's very tricky. And I really don't ask most people to do that, to be consciously doing that. But with bodybuilders and someone as elite as Sergio, you can do that.
As you're gonna slowly try to turn that a little more, so pull a little bit from your heels, like a tiny little bit of hamstrings. Yeah, okay.
And these cues that I'm giving him are to get the best stack I can between his pelvis and his ribs. And then we have Fit Buns making an appearance, his lovely lady. They are adorable together. Sergio is so strong.
And then when you're breathing, the breathing's actually, it's fucking everything. It's so annoying. So you're gonna do really long, silent inhales through the nose, 4 to 8 seconds, and then sigh out about 4 to 8 seconds on the exhale. Long, so this rib kind of drops at the end. If you stop feeling that, let me know. It might even be your bicep and stuff too. I'm gonna have you bend your elbow just a tiny bit. If you cannot go into that compression. You okay there? Is that painful?
No, it's okay.
Just chill.
And you can tell by the way he's breathing and speaking, this is a hard thing for him to do, trying to keep this stack and keep it from going into compression. Nothing's going on, but you're fighting a lot of things that your body wants to have it go on. So that's why it's really difficult.
Maybe a little more of these ribs drop at the end of that exhale, but it's tricky because you can't like activate hard abs. It's like deep abs to do that. There you go. Yeah, there we go. Those are good. Now we're getting a little bit of air through there. Four more. If you get numbness, let me know.
And the thing is, when you're dealing with a compression issue, if that is your main issue, that means, again, I cover this in the video. There's some good visuals on the delts where you can actually see the rib cage squished. Whenever that rib cage is squished, and it happens more on that left upper back area all the time, there's no other option. There's no other way to fix that besides posterior expansion, besides getting that to move from the inside out. You can't do soft tissue work. In fact, sometimes that can be counterproductive if you really hammer the area that's tight, kind of driving into an area that's already compressed. It can actually reinforce that a little bit. Again, some soft tissue can help. I did some on Sergio, and it actually helped his internal rotation dramatically at the end, but you have to really know what you're doing. There's no really like corrective exercise. You can try to like do like protraction, do serratus drills, but if you can't get that posterior rib cage to expand, the scapula is just not going to glide over it effectively. So maybe you kind of stumble your way to a little bit of improvement, but the only way to really fix this, there's really only one way, and that is to do this bullshit that we're doing, which isn't the funnest thing. Again, I wouldn't do it. I wouldn't waste my time with all this if I didn't know the benefits on myself, as far as my not having any kind of limitations as far as joint pain, any kind at all, and also on my aesthetics, but also all my clients over the last 4 years that I've been doing this.
You have any more rotation with the thumb at all? Yeah, you might gain a little bit as you're going. Yeah, if you get shaky too, that's a good sign. It means you're in there. Good. Yeah, there you go.
And it's hard to see, but he is starting to get like shaky. That's like your neurological towel just ringing and trying to grasp what's going on, trying to let stuff go.
Make sure you have pressure on the inner part of those feet. It's like annoying. All right, look, let's take a quick second. I have you do just one other variation. Just hang straight with that, palm up. Same, I got you. Same breathing style, but every exhale, you're gonna let your knees go just an inch or two to the right.
So this is another pec inhibition.
Just let that fall just a little bit.
To the right, okay. But keep this here.
Yeah, that one's just, this time you don't have to turn the phone. Okay. It's a little different one. And then same breathing.
And I'm doing 2 on him because these are so tight. I normally would do 1, but these are a little bit different. You get a little bit different things involved.
Not really coming up.
Not coming up.
They will, but we want like a relative motion.
But don't try to do it.
Yeah. You can think about them sitting down, and that will probably take care of it. There you go. Does it feel different when you get that kind of a breath? That's what we call 360 expansion. That's why this shit works, because it's the only way to change your shape of your axial skeleton is from the inside out. That's right.
That's kind of what I was just talking about. This is the only thing you can do.
That's right. Try to get just a second after that exhale. Give yourself like 1 second before you inhale.
Now, I was a little worried that he would over-rotate just through his spine, but again, he's grounding himself really well, again, because he's already a little turned to that way, so I was worried he would exaggerate it, but this is perfect.
Okay, so let's see if I did anything just for the pec at all. I think that's going to be pretty minor, but there's a lot of shit we're going to do. But already have some decent right there. See if ER is any different. And that's okay. So that pec inhibition, you keep doing that stuff. You need to do that for a minute.
So that's why I do the inhibition first, because that can give you some instant changes. We got a little bit of range, nothing crazy, but if we hadn't inhibited that pec first, that would be just sitting on the table. And the moves that we did later might not be nearly as effective. So then I'm just doing a little bit more easy manual stuff where that pec attaches to that bicipital groove a little bit, trying to loosen that up. Doesn't feel good. You can tell by Sergio's face, but I think he's not the best at dealing with pain because I'm not going too hard. All right, so this is another part of the testing that we did, and you can kind of see here the right side, no limitation to get into that wall. We've got posterior expansion occurring in that rib cage on that right side. We go to the left. Right there, his body doesn't know what to do. Once he gets about right here, in order to get any further back, he's got to start doing something funky because that scapula cannot glide. So nothing that I saw in this assessment is like bad at all or worrisome at all. I think that Sergio is super connected to his body and he's able to work in around kind of any limitations that he may have. And I think he's probably always worked a little bit of extension and compression strategies just like every single bodybuilder ever. But if I had to guess what caused this to suddenly flare up, is possibly, I know that he had a little bit of a fall recently, and that could have just changed things up. That could have been what took away that left hip internal rotation. I also know that he was training with Dorian, and he really was motivated by Dorian, and I know he didn't want to disappoint him, I'm sure, but I know he wanted to really push himself hard. And so there's a good chance while going through that, getting that high intensity force reps, we could have oriented a little bit to get that one extra rep out. This is stuff that just kind of builds up over time. It might not be like a big deal until one day. It just is, and you're really limited. But there's nothing serious here. There's nothing that's going to be long-term. This is all easily fixable within, like I told him, probably like 3 to 5 weeks. You should have like no limitations whatsoever. Within 2 weeks, you should be pretty much already there. If you're doing this stuff really consistently, which you have to, because you're reinforcing the negative pattern all the time. You got to reinforce that positive pattern at least a couple times a day. So I didn't really cover a lot of the techniques that we did, just a couple things. So I'll describe those. But all the other techniques that we did that I didn't film on here, they're pretty much all in that 3D delts video. We covered all those. We didn't get to the point where we did anything inverted. It's because he's a little restricted to get to that point. But pretty much everything else in there, because we really needed to get that dorsal rostral area to expand on that left side. So here, I think this might have been the very first thing we did. This is just called a lazy roll. And you do this when someone's just squished like a pancake, which every bodybuilder, every powerlifter is. This is not unique at all. There's nothing special about Sergio in this sense. This is pretty much what I see. The only thing that's a little more unique about him is that he's a little more turned than I typically see. But I think that's just something that's happening right now. I don't think that's how he normally is. So I don't think it's something he's carried with him for a long time. So that's why I think it'll be really easy to fix.
Okay. I'm going to flip you on your right side. Reach over. Let's lengthen this right side a little bit more.
So I'll try to use the hips to show you a little bit of why we're doing this. So this is a lazy roll, and this is what you want to do when someone is just really squished. So when someone's squished, that means they're going to be dumped forward. And for your hips, squished means like that, flattened front to back. Same thing with your rib cage. So if you're laying on your side, just using gravity and rolling over that a little bit with this femur right here, just rolling over that tiny little bit is going to help create IR space. It's also going to help get this ilium to not be so flared out because you're kind of just using the weight of your body and gravity to turn it in a little bit. Remember, this left one is really flared out. I'm on my side. I'm going to turn over that. So we're doing this to try to restore a little bit of relative motion, particularly internal rotation. And I have him doing a little bit of different setup on his left side. I have him kind of just lengthening the right side a little bit more and a little more emphasis on getting the knee forward a little bit more. And I'm also applying pressure to his ilium and to the rib cage.
And then kind of the same.
Because your rib cage and your pelvis, those bones are like really malleable. You can move those pretty easily. If you just put like a 40-pound kettlebell on your hip when you're doing this, you can make some pretty significant changes.
In concept, we're going to go over more with the right. Okay. It won't come back as much.
Okay.
But it'll come back even. It'll be like on the ground. And then on this one, don't worry about the hands. Mm-hmm. Just reach with his right arm. With the right. Unless that bugs or anything. Not so much about like right there. We're just trying to lengthen this a little bit. Okay, turn over this hip a little more. Okay. All right. So we're done.
So this is interesting. His ilium is really weird to me.
Don't quite come over here. Hold this a little bit.
You want me to hold it on?
Yeah, hold
okay.
it. Unless that gives you issues, but that shoulder should be good. What the fuck is up with your ilium? Okay.
So you hear me there. I'm like, what is up with your ilium? And he's just so turned. It's pretty unique. It's not that normal. Like I said, it's very acute right now. I'm sure it's not normally like that. So it actually was like a totally different position than what I would expect to normally feel it. So that's how kind of out of whack it was at this point.
There we go. And exactly, you're creating that dome. You're trying to get like a cylinder shape to this rib cage. Lift one a little higher.
And then this is just the left adductor pullback. So we had done all of our inhibitions before this. We did the pec inhibition that you saw. We did a paraspinal inhibition. We did the right intercostal inhibition. We also did the left posterior capsule inhibition before we did this. If we hadn't done those, this probably wouldn't have been effective. So if you've seen any of my videos, you may have seen me talk about this before. This is a really good move to create internal rotation on that left side.
All right, so we're going to inhale. And as you inhale, pull that left knee back to me. As you exhale, squeeze the fuck out of that ball. Like, pretty good, okay? All right, so inhales, we're coming back, and we're always domed, and we're always doing that same breathing. That's really good. All right, inhale back, exhale, squeeze. We want to feel that inner thigh like light up on this. If you don't feel that, let me know.
Go ahead.
Yeah. Go ahead and apply a little pressure with your right knee kind of into the ground too. That's just.
So I told him to do that because as he's pulling back that left side, I can see the pelvis is orienting a little bit. So if you apply pressure down with the other one, as you pull that left one back, that'll encourage relative motion because that right side will be like stuck to the ground. So if I'm pushing this right side, as I'm pulling this left back, that's gonna be relative motion. If I don't, it might just lose a little bit of that relative motion and orient.
Keep that part from kind of going with this. Make sure you're not getting too much extension. Any inner thigh at all? This ball doesn't have a lot of give. You don't normally use a towel, so if you don't feel a lot of your thigh, I'll switch. So as you close, don't lose any of that range that we've moved back in.
Okay, gotcha.
Yeah. So inhale, cool.
I should have him turn his left foot in a little bit more watching this now.
Excellent. There you go. It's gonna be 2 more of those.
And his left
So if
foot's
you
coming
feel
off.
here, we
And
don't.
his right foot's coming off.
We can feel a little lower. That would be okay. But the inner thigh is the main thing we're looking for. Is that what you got? Okay.
So on that, I'm making sure he's not feeling his TFL, which is a compensation pattern you would have if you didn't have internal rotation space to move into. He's feeling his anterior glute mid, which is great, and his ipsicolumnar adductor, that really high adductor groin area, which that's what we're looking for. So here we're just going over some fly mechanics, and this is exactly what I go over in that video I made. And when he was doing his flies, he's just getting a little early elevation, which is normal when you have that compression. So we're just trying to teach his body and what it feels like for his delts to actually do the lifting up with a scapular position, a little bit more abducted off the body and a little bit of what we call posterior tipping, which is gonna kind of take it off of these really tight middle back muscles and put more on the delts.
That your body has. Okay, so let's try that again. All right, a little more forward. Push, push, push. There you go. And so that should feel like less discomfort though, right? Just more on the muscle. Really good. Even a little more, a little more.
And again, since Sergio has such good mind muscle control, he can do this pretty easily. That is actually really, really hard to get out of that compression and push that forward when you have a lot. And that's why bodybuilders are actually really easy to help, because when you can activate those really underactive things, you can make the changes faster. Like some people, I have to set them almost perfect before they can connect to something. Someone who's got a really good mind muscle connection, they can feel that connection a little earlier and it can help bring them back to neutral sooner.
Yeah, there you go. Try 3 of those. So yeah, just go light on these. Yeah, that's solid. I mean, your right's gonna be easy to connect.
And you can kind of see the orientation of his pelvis just standing there. So it would be a little bit of a process. Like I said, about 2 to 4 weeks. And I think Sergio would not be really feeling anything. So I'm definitely excited to get back out there. We'll film a little bit more content for sure.
Because that scapula's further away. One more. So get a good inhale on the way down.
And we need that inhale on the way down to promote that posterior expansion and the scapula gliding outward on the thorax. So after we did all the non-manual techniques I mentioned and the ones that you saw here, we saw some pretty decent improvement. We gained about 15 degrees of external rotation, about 10 of that shoulder flexion. So pretty good in about an hour and a half. Again, we need to reinforce that now through kind of specific loading patterns, usually like reciprocal or alternating. And then when we do the bilateral stuff, we want to make sure that we train our body to do it in a way that to not want to go into that compensatory compression so soon, at least. And again, you're going to be compressed if you're bodybuilding. It's going to happen, but you want to have space to move into. You want to have compression to move into. You don't want to start that way, if that makes sense. But nothing's crazy. Nothing worries me at all. Sergio's a smart guy. He's really connected to his body. He really absorbs all this information really well. So I think he's going to make really good progress. I'm happy to kind of help him out in any way that I can. He's just a really good dude. So I'm definitely going to try to make it back out there to do a little bit more work with Sergio and to probably go into the gym and to try to translate some of these mechanics under load as well, because yeah, he's an amazing bodybuilder. He's one of the top 10 in the world. We need to see him back on the Olympia stage. And if I can have even the smallest minor little role at all in doing that, I am very excited to do that. So let me know if you guys have any questions below. I'll try to make the next one a little bit more like professional looking. All right, thanks.